Schellenberger. I'm an ENT doc. So patients come in all the time complaining of nasal problems. And the vast majority of the time, the first thing that I ask them is, are you on any sprays? And if they're not on a nasal steroid spray, a lot of times our go-to for allergies and sinus issues and nasal obstruction is to say, hey, start on a nasal steroid spray. They're over the counter now, Flonase, Nasacort, and the generics of them. You need to make sure it says either nasal steroid or Flonase or fluticasone, or it's a steroid, not a decongestant. I hate decongestants. But a lot of times patients actually kind of put them in their nose wrong. And a lot of times patients will just, take the spray and spray it like this. That's not going where it needs to go. That's actually spraying the septum, which is the between the two sides of the nose. And if done consistently over a long period of time, it can irritate the septum. And I actually have seen many patients who come in with a septal ulceration and even sometimes a septal perforation where they have just sprayed so consistently over a period of years the septum that it's actually degraded the lining of the septum and caused ulceration or even a perforation, a hole between the two sides of the nose. So it's actually, I've thought to myself, hey, we need to give a video on how to do this correctly. You want the spray to go back and if not back, a little bit to the side. And so what I typically recommend is to use the opposite hand for the opposite nostril. That kind of keeps you from, you can't go to the septum as easily when you're doing that. So if you take it like this, like that, and like this, kind of back and sides is really where you want to go, okay? And again, just wanted to have a simple, easy video of a way to spray things in your nose that doesn't go the wrong place. Again, back and sides, all right?